Okay, welcome to the MICT info session. We're going to discuss a little bit about the MICT program is. I usually have three big questions that I normally ask people besides this program, this presentation. Is to start thinking about it as we go through it. I'm going to ask you some questions about your professional goals, where you see yourself, a few years from now. I'm going to ask you another question would be financial. I know it's personal, but it's financial. I want to make sure that you can manage this class because it is a long class. It takes you out of your normal economic means. It's going to be some pay cut, and some people might not be able to work at all during this. And then the really personal stuff is the personal lifestyle, like family, girlfriends, children, parents, those kind of things. I got to find out if we're expecting children, we're having issues at home. These three areas, if we have any major concern in those three areas, probably best to think about it, really scrutinize and critically think about, is this the right time to go through the program? I mean, basically I think this thing is supposed to say, have you prepared, and how do we prepare for it? Was to get the courses that we needed, or the prerequisites, and the road time. So yes, it's exciting to think about moving into the MICT profession. You are all EMS providers already. You have operational experience. Probably been doing some of that advanced stuff while working with your MICT partners. And if not, we want to try to create that environment for you so that you can get more of an experience prior to coming to class. Because the worst thing to happen is to come to class and not have enough experience based on what I think is required when we go through class. As we move through this experience process, everybody knows that we have to fill out an MICT application that we can get off the internet, or sometimes if I don't have this packet, it's daunting, which means that it's a large, there's like a magazine, right, full of stuff that you have to come and document. It's all the courses that are required, those prerequisites. It also has essays that are in there. It has different references. You got to put it in your driver's license, your driver's abstract, your BLS cards, your national registry cards. All of these things should be up to date. And if there is some type of recertification process for your national registry EMT, make sure that you have all of this stuff ready, or identify that to me early on so that we can start documenting the retraining during MICT class. Because all of the classes that you're taking during MICT is applicable for some EMT CME credits, so you can use that to put in for your national registry certification process. Applications, though, we can help you with that, and it's going to be one of those kind of growing process. You're going to start, you're going to put it to the side. You're going to pick it up and start again, and you put it to the side. You're going to start and put it to the side. Currently, we know that a lot of students, or a lot of applicants, procrastinate a lot. Because they want to go initially, and then having worked in the field and working just takes the precedence over getting the prereqs. Sometimes, the college classes is one thing, but working in the field is what they really like doing. So we procrastinate and we don't get those credits. That being said, some of us might be still working on the credits for this coming semester. Is there anybody in the classroom who's still working on credits for this semester, or you guys all have all your prerequisites?
I still gotta get that.
Okay, so you applied for that too. Yeah. All right, so we know that this happens, and so we make it a little more difficult for us. And now we're going to keep the application open up until May, so that you can get that credit and pass that course, so that your application is complete. If we were to close the applications, let's say in March, we cannot accept an incomplete application, which would mean those guys that are working on the courses, we'd have to say you're not an applicant, and we can't go through what's the other processes of getting into the MICT class. But we're going to keep it open. So we don't want this to be the norm. We want to bring more info sessions so that we can work on this packet as soon as your crew class is done, and you find that I'm out on the road now, and I've been out for a year. I'm not a probational employee. I've been working for a while. I feel like I got some experience, and MICT partners have been helping me get along and doing my workload, and I feel like I'm getting these courses. Come to the class so we can do a year of prepping before we kind of get into this. One of the worst things with the application process is that we finish all of that, and then we're not sure where we want to go. And this process, we have interviews as well as a written exam that has to be taken, skill tested, and then we decide, oh shoot, I'm not sure if I want to go. You kind of wasted a lot of your own time, and we feel bad for the guys that did all the work and then just didn't polish themselves up to take the written and then didn't do that well. Okay, so here's that same questions that we talked about. We take a knowledge-based exam. It's a lot of, I'll give you guys a mini study guide later on, but it's a lot of math. Gotta tell you guys there's math. And in that math is applicable stuff for EMS. So you wanna go back and practice this stuff by looking at medications, looking at the volume and the units. So you can calculate the unit per volume. What it means is that if you have 10 cc's and there's 1 milligram, that's something like epi, 1 in 10,000, 10 cc's in 1 and 1 milligram. What are those 10 increments? 0.1 milligrams. So you gotta learn how to be able to calculate that. We also do some drug calculations because you guys will understand that it's important as we run those cardiac arrests and running amiodarone, post cardiac arrest for VTAC or VFib, or even if they're conscious VTAC or VFib, we may run this antidosarrhythmic drug and it has to go over a certain period of time. You need to know how to calculate the drip rate. So think about that. It also has a lot of just basic EMT now. This is basic EMT. There's no paramedic level stuff. This isn't supposed to talk about rare diseases and treatments of it. And basic knowledge exam. This exam is going to be online and be out of the testing center. We have some dates scheduled tentatively. I'm looking at sometime in July that those dates will be open for you guys. Again, it'll probably be pushed out when I email everybody out. You'll go into there. There'll be a secured site password that you take, and you'll get your results immediately. Now that's just 25 points out of 100. The EMT skills exam, usually you run you right through all the National Registry skills. This may plus or minus include some of the KCC skills, such as the EKG and 12 lead, because there's no National Registry EKG or 12 lead or vital signs assessment. But it's just looking to see, do we still retain this more regimented form of National Registry, just going down by the lines? So learning that we're gonna have to just prepare and study for that skills test. There's nothing that we're gonna throw out and make hard scenarios at it. Okay. The next one we're looking at is your overall GPA. So the higher your GPA, the more points you get. What I felt was that if you took the 198, the 198 is a ride-along program. This takes you, it puts you in the back all the time on every call when you ride there. I wanted that to be the top right there. If you took this, plus all your prereqs, I'll just give you 20 points, but I have to change this program statewide. We have 3 programs, and in order to make that change, all 3 programs have to use the 198 program. So currently it's not. The next one is an interview. So I'm looking at bringing in people to give you some questions. You would respond to those questions, and basically there's a point system. Usually the instructor is not involved, but would have the program director, maybe the medical director, the clinical coordinator, guys outside of EMS. So it might be hospital administrator like Arthur Sampaga, Kaiser nursing administrator David Espili. They wouldn't have anybody from AMR per se, or Hawaii County Fire. We may have a Fed Fire personnel that might come down, or even somebody from Oahu. The essay is something that you guys write and turn in. It's in your application packet. And then I didn't realize until a few months ago when we started to put this together that your EMT class grade was 5 points. I remember this back in 1990 when they had the before Lori, which was Michelle. She said only the 2 top students from each class, EMT class, would ever be accepted into the MICT program. I laughed because I had about 6 of us that came from one EMT class. We weren't all the top. One is Winston, Bertram, myself, Christina Judson, and I forget one more guy. So here's that breakdown a little bit more about, so this test hasn't changed. It's been like this for ongoing years. And they may be looking at changing the tools on the questions. Here's those skills that we're going to go over. And again, I would post this up there somewhere on the Laulima site. So I'm going to get you guys access into Laulima. So the skills are always the freshest, newest skills. You don't have to look for them. They're right there for you to download and use. But they haven't really changed a lot, right? Some of them just the timing. These are your prerequisites that they're going to use for your GPA. Now, again, the math equivalent of 103, there may be another equivalent, and then the anatomy and physiology, it's not just bio 130, 131, there may be an equivalent. As far as this prerequisite, there may be waivers for like anatomy and physiology. Is that supposed to be like a 5 to 7 years where if you're not using that information and knowledge, then we ask you to retake the class. But this would be the foundation for the course because we don't have a lot of time to go back over the anatomy and physiology or med terminology or the lifespan. We're going to just start to interject and we may review a little bit, but not definitely go over the entire human body systems. Which recruit class is this?
We do 7.
Huh? So again, the interview questions, I'm not exactly sure the type of questions, but they're looking at how well, I mean, it may not be medically based. They're just looking at how well you respond and how you analyze the question and then how you formulate that answer. So think about it, it's not a simple one question, one answer to it. These are kind of broad questions, and if they're that broad, they require you to like really elaborate and give examples when you answer these questions. So this essay you guys will put together. Think about it, take the time to really look at the question, and then make sure when you write it, have somebody else read it and then submit it because they're looking at the bottom, and it's just a simple rubric. The answer, the way that it's evaluated to a rubric will tell us and give you your score, but they're looking at those categories on the bottom, the clarity, whether or not you have this thesis statement, is the paper organized, and as I read it, is there a flow through it? Then during that, can I take out and find the rationale or the content, and then any spelling or grammatical errors. We've been taking a call log, so most of you have been logging your calls, but if not, then you got to go back to WebCurve and start pulling that data down. In the past, we would require you to have these 300 calls, but they would also have to be like signed off by the medic or senior personnel that's there. I wouldn't necessarily agree that being on an apparatus and going through calls will give you that call volume. So if you were on an apparatus and you said, okay, I responded to this on an X, or I was on an engine and I came out, I'm going to log that down. You can similarly, like You know, if you're doing a patient take home on a non-emergent type transfer, is it comparable? 300 calls is 300 calls, but it's, you know, the experience that we're looking for in that 300 calls. So think about it as you guys write the calls down. We don't scrutinize them, but it's supposed to give us enough experience and time in the field. Hey, morning. So as you guys are out there, we can't expect that you're going to be an MICT coming to MICT class, but we do expect that you come into class with more experience and knowledge than the newest guys leaving the EMT programs. This means that when you are asking these history questions to patients and you're doing your assessments, that you are formulating and taking the answers that you're getting and the assessments that you're finding, that you're formulating a kind of clinical impression. And your clinical impressions, as I'm going to explain right now, shouldn't be just, oh, I think this is cardiac chest pain. Chest pain could be multiple things. And if we are at the lowest level right now, kind of just learning to start ALS calls, it could be musculoskeletal, it could be stomach issues, it could be respiratory issues, it could be traumatic issues, it could be psychological issues. So just don't try to stovepipe or tunnel into just, oh, this must be cardiac only. It could be a variety, and that's where I think the knowledge as an EMT come into class is one that they're not always just pinpointing and giving one clinical impression. This is cardiac chest pain. Well, this might be cardiac chest pain, but it might also be this, or this. We're not really sure because we don't have the definitive tests that we would do. You know, not unless your 12 lead EKG shows the STEMI, we're really not going to be able to determine, so we kind of have multiple clinical impressions, unless it's a classical picture. So this is what we're hoping, that you're being able to use that information, use the training that you've had, start to have a clinical thinking process, and you are learning how to work in the environment. That means that you have now a sort of situational awareness. In the classroom, when you first start, somebody who says, you know, use the gurney, they have no idea that the gurney has to be brought into the house and how to get into the house, that they can actually move furniture so that the gurney can get in. Now you guys understand that because you've been working on it in the field. But if you remember, yeah, we had some gurney exercises, but when it really came down to it, like, I got to get the gurney into the house, and then I got to get the gurney back out, and then you got to load the gurney up. And when to put on the EKG, and when to take it off. When to give oxygen, when to add more oxygen. These things just slowly start as you learn the skill set. Being aware of when it's supposed to be implemented is what we're looking for. They highlight the patient assessment. Continue to work through the patient assessment. A lot of times at this current level, we feel like that there has been an assessment, there have been history that's been done by the medic already. In fact, even the pre-arriving engine company with medical personnel already there did their assessment, did their vitals, did the history, and are telling you exactly what to do, and you just go in back, you lock the doors, and you take off. We want you to re-establish that history taking, start all over, or reconfirm. Just go back over your sample OPQRST. Make sure you get that down. Don't just take everybody's sample and OPQRST for granted. You see this being done when the medic shows up, even though the engine company was there with a medic. You'll see this being done by the nurse back in the emergency room, and you'll see this done by every doc and every professional that comes back in. They're always going to ask that history questions all over again and get their own assessment. This means that you'll focus maybe on the primary complaint, but then do a good, thorough head to toe. And in this time, we're hoping that once you develop those skills, you'll be able to identify, wow, this guy really looks sick, he's breathing really heavy, or he looks pale and he's very diaphoretic. You'll pick up these things on sick or not sick prior to coming into our classroom. Okay, so this is some of these questions that I mentioned earlier. We look at the finances, relationships, but I mentioned to you guys, like, where do you see yourself? Professional goals, what is the private matters and personal matters that you have, and then finances. Those are big things. The time management and study skills, that usually comes in with the preparation because it takes quite a long time for us to develop and learn all this information. You can ask all the current MICTs out there and the most recent MICT graduating class. It's a lot of knowledge and a lot of stuff that they have to learn. And it requires them to study quite a lot. I mean, each class grumbles about how much time the next class is spending. They're not spending enough time studying, not enough time practicing, and the like. So at this current time, I'm just going to kind of open it up to questions.